I'm Dr. Annet Nakaganda, the founder and the director at Ananda Center for Cancer Research. I thought of the message I could give out on World Cancer Day, and I thought a personal story of what drives my passion would be the best to really show how tirelessly we really work to help cancer control in our setting, and how we stand with everyone who is battling with cancer. Like many Ugandans, I carry a personal and a professional story to tell of the cancer burden. I have been in cancer research, mainly clinical trials, for over 20 years now, and I've really worked with vulnerable populations throughout their lives. So many years ago, while working at the Uganda Cancer Institute, I saw a woman who walked into the research clinic, and this lady looked familiar to me. And I was like, where did I see her? I later remembered that I enrolled her about 7 years ago in the prevention to child transmission of HIV study. That is a PMTC study, while I was working with Makerere University Johns Hopkins research collaboration. So when I saw her, I asked her that, why are you here? She looked at me and she responded a bit quietly. She looked a bit exhausted but hopeful. She told me, Musao, I'm here because I'm told that I have cancer of the cervix. The sad story is they have told me that this cancer has spread all over my body and I may die soon. Can you enroll me in a research study? The last time when I was pregnant, you enrolled me in a research study and you saved my baby from getting HIV from me. She's now in P5, and she can now make me a cup of coffee when I'm weak to go out of my bed. My heart sank. I had no research study to offer her at that point in time, and I told her the truth, that unfortunately, we have no research studies now for the type of the cancer you are suffering. All what I could do was to turn the conversation to her daughter, trying to mask the pain I was going through and the helplessness as a clinician I was in. But inside me, so many questions were running in my head. I was asking myself, had I screened this woman at the time of enrolling her in the HIV study, would the outcome be different? Why hadn't she, first of all, the HIV clinic provided her routine HIV screening? And I was like, what is the point of saving her from HIV only to leave her die silently with a cancer that is highly preventable? So that day, I really understood that something, profoundly is painful, and something is not right with our health system. Our health systems are really very reactive, not preventive. We really wait for people to get sick, very, very sick, before we can act. That experience pushed me to make a lifetime commitment. I was actually convinced that many people were suffering from preventable problems, and that we cannot all sit in the clinic room and wait for stage 4 cancers to be enrolled in clinical trials. I made a commitment to go into public health, and I have spent almost a decade, more than a decade, studying how to design programs and systems that could prevent disease occurrence, in particular the occurrence of cancer. So in 2022, I'm happy that I founded Ananda Center for Cancer Research. Ananda Center for Cancer Research is an NGO, a non-government organization with a mission to translate research evidence into policies and laws that prevent cancer and saves lives. At Ananda Center for Cancer Research, we always focus on changing the structural systems and legal environments that allow cancer to flourish undetected and untreated for so long. But still today, with all our effort, women like the one I met are still flooding at the Cancer Treatment Center at the Uganda Cancer Institute, still in advanced stages of their disease, many of which cancers are highly preventable. I really feel that this does not have to be this way. And I call upon everyone, because we have the tools, we have enough knowledge to prevent cancer. What we lack now are strong policies, enforceable laws, and the political will to prioritize cancer prevention and early detection. So I call everyone to really recognize that we need to institutionalize cancer screening, especially cervical cancer screening, especially in HIV clinics. We must roll out HPV vaccination nationwide without a delay. We must not leave it, for example, for health education. Health education is like we leave it up to the individuals. It's up to them. We as the system, we must own the system and take the cancer prevention like HPV vaccination to the individuals that need it. We must fund and enforce laws that reduce exposure to the known cancer-causing agents. The carcinogens, we know them. And we must invest in early detection and education. And most importantly, we must increase the access to the oncology medicines. I'm so happy that Ananda Center for Cancer Research, as I talk now, is a partner and has joined the UICC Atom Initiative. And this is a very great opportunity that drives my passion, further. So, dear members and everyone, on this World Cancer Day, I want to remind you, all what we have to do is to make our days count. Let us act while we can. Let us use the power, let us use the authority we have to create laws and policies that save our lives. As I've indicated, we really have the tools now. We have enough knowledge of what causes cancer. We just need the policies, we just need the laws, we just need the political will to prioritize cancer prevention and early detection. For every woman like the one I met, for her daughter who was in P5, and for everyone in this world. Thank you. Join us on the World Cancer Day, 4th February. Thank you.